Hello, everyone. My name is Margaret Lee. I'm the proud owner of Hygienics Laboratory Services, and welcome to my channel, your go to source for all things specimen collection. Whether you're a seasonal professional looking to sharpen your skills, a business owner navigating the world of compliance, or simply curious about what goes into high quality laboratory services, you come to the right place. At Vigenics, we're passionate about precision, professionalism, and creating safer, healthier workplaces. And I'm excited to share that passion with you. So if you're ready to elevate your knowledge and expertise, don't forget to hit that subscribe button and turn on your notifications so you never miss a video. Let's get started.
All right, Mr. Joe Riley, the mastermind really behind Vigenics Laboratory Services, because when I first started, I had no idea what I was doing, but I just want to thank you for taking the time out with me because it was in 2019, I believe, and I reached out to you, looking over your website and everything like that, and I was just afraid to jump in. But then I was led to reach out again, and in 2021, you really helped me and helped me with my house accounts and my lab accounts, the MRO, explained everything to me, and I just hit the ground running from there as a collection site. So I just want you to introduce yourself, if you don't mind, to my audience. And I have a few questions that I want to ask, a few frequently asked questions that I get asked. But to hear it from an expert like you would be awesome.
Yeah, so welcome to your audience. This is Joe Reilly. I am a professional and an expert in the drug testing industry, having gotten started about 33 years ago. So, not the smartest person in the world, but if you do something for 33 years, you ought to better get good at it. And we help small businesses, collection sites, TPAs all over the United States. We only work in the USA, nowhere else. And we do a lot of training, we do a lot of consultation, custom work, anything folks need. Someone has a quick question, they can call me anytime, no charge, or a quick email. Just don't text the question, always email it, or call me, because it's hard to type on the phone, especially if the answer is long,
Right.
or especially if I have to copy and paste it from my website or something like that. So, Joe Reilly, president of National Drug Screening, president of Joe Reilly and Associates. Glad to be here.
Thank you. Thank you for taking the time to meet with me today. For those who don't know me, my name is Margaret Jade Lee. I'm the owner of Vigenics Laboratory Services and Vigenics Technical Training Center, where we offer extensive phlebotomy training. And I call it extensive because we are one of the only that I know phlebotomy program that attaches DOT specimen collection. And Mr. Joe Riley helped me. What is it going on now? About 4 years ago, I reached out to him and I really didn't know where to start in this industry. I just woke up one day, I was a phlebotomist, medical assistant, and I knew I wanted to work for myself. So I knew a little bit about the mobile phlebotomy, but I was interested on how does it work when you go and get a drug screen. So that's what I did. And every time I had a question, like he said, I sent him an email. We set up a meeting just like this, and he got me on my way. So, not to hold you long, Mr. Joe, but I just want to ask you what inspired you to become to start in the industry, kind of like how mine was. I was already in the medical field, but I wanted to, dip into a different side. What inspired you?
Yeah, so I've been an entrepreneur since I was a kid, actually. I had some little side businesses when I was 13, 14, always looking for ways to earn money and do something and be able to take care of myself. I didn't grow up in a rich home or anything. My parents were week to week, and you didn't really get a big allowance. If you got $1 for a week, you were lucky. So I had bigger hopes. I needed to make more money. So when I moved to Florida at 22, I was in a couple of different businesses, and I ended up in a risk management consulting business for the hospitality industry here in Florida. And Florida passed a law on that said that if a business implements a drug-free workplace program, they would automatically get a 5% discount on workers' comp. And that was really what gave me an idea that this could help businesses save a little money, but also help them from having drug users being on their payroll, which can cause very devastating effects that could really completely on edge a small business if somebody gets in an accident because they were using illicit substances. So those were kind of the two things that led me to it. What really got me passionate though about this business is as it was growing, like every year its business doubled from the first year, you know. And so people always say, well, how much money can I make in a year? And I say, well, whatever you make the first year, you can double it the next year probably. Okay. But in 1997, like 4 years after I started, they started the National Drug and Alcohol Testing Industry Association, National Association for people that do what we do. And today it's called INDASA, the National Drug and Alcohol Screening Association. And when I went to their first annual conference, which was small at the time, maybe 100 people. Now they get 600, 700 people at it. I'm meeting 100 people that do exactly what I do. We're sharing ideas and open communication and not looking at each other like competitors. Everybody's trying to help each other. And that got me really passionate about this industry.
Wow. Yeah, because it does take teamwork, considering even all of the key players in the drug free workplace program. So, talking about the industry, what major changes have you seen in the DOT drug testing world over the past decade?
Well, let's go back 2 decades, 2.5 decades. Okay. Um, in 2001, they did a complete rewrite of 49 CFR Part 40, which is the overall DOT regulation for drug and alcohol testing under DOT. Okay. Um, and it was readable. It was written in plain English, so you could understand it. Okay. And what I've done over the years is I've read that regulation probably 10 to 15 times. Okay. So that if somebody asks me a question about DOT drug testing, I know the answer based on the regulation, not pulling the answer out of my hat. I know the answer based on the regulation. Now, over the years, there's been some changes to that regulation. So you got to keep up with the changes. Back in the early days when we tested for opiates, we tested codeine and morphine only. And then later on, they added heroin. And then later on in 2018, they added the expanded opiates of hydrocodone, hydromorphone, oxymorphone, and oxycodone. So if you sell a 5-panel drug test DOT, you're getting marijuana, amphetamines, which includes methamphetamines, ecstasy, MDMA. You're getting PCP. You're getting you're getting the opioids today, which includes the hydrocodone, hydromorphone, oxycodone, and oxymorphone, and you're getting cocaine. But if it's non-DOT, you better be sure you're getting the right DOT, the right non-DOT panel. We call it a DOT-like panel, which means we're getting the same configuration of drugs that you got if you ordered DOT. If you don't order it properly, if you don't have a vendor that can explain it to you, you might get the old original version because the labs still have it. They're like a clutter person, you know, someone who's never thrown anything out in
Right.
their house. They have electric bills and phone bills from the 1960s, like my mother used to have. Okay, so they got a 5-panel drug test at the lab that only doesn't include heroin, doesn't include oxycodone, doesn't include methamphetamine or ecstasy. So
Right.
you better know what you got to know your panels. You
DOT
got to
light.
know your panels. Those are some of the changes. We're going to see fentanyl added. You can add it for non-DOT today. DOT will be soon. Oral fluid, non-DOT for the last 10 years. Fentanyl for non-DOT. You're going to see oral fluid for DOT. It is approved, but we're waiting on laboratories. There's little tweaks here and there, clarifying things, what collectors should do and shouldn't do, and what DER should do and shouldn't do.
Okay, awesome. Awesome. So for beginners, how would you explain the difference between DOT and non-DOT? Because that's a big thing. I had someone go and pay $1,500 to someone. This was in 2021 when everybody was coming to me asking me to train them, but my integrity wouldn't let them because I was still calling you for simple things. So they paid that much money, but I was able to at least answer that for them. What's the difference between DOT and non-DOT?
Okay, and you got to break that down into many different sections from the collection point of view, from the employer, what they do, what the lab does, what the MRO does, what the SAP does, what the breath alcohol technician does, what the screening test technician does. All of those things are regulated in DOT regulation 49 CFR Part 40. So companies that are regulated by DOT, trucking companies, airlines, oil and gas pipeline, transit systems, railroads, Coast Guard regulated businesses. For those covered DOT covered employees, they have to follow that DOT regulation to the T. There's no variable. It has to be done this way. And it has to be done on a federal custody and control form. It says federal right on the top of it. Okay. Now, for non-DOT, you cannot use a federal drug testing custody and control form. So non-DOT is all the other businesses, which is 10 times more than the DOT businesses that are not subject to 49 CFR Part 40. They're not truck drivers. They're not airline pilots. They're not pipeline operators. They're every other kind of business, including manufacturers, machinery plants, all different types of things. They can test for the same drugs. We call it a DOT-like 5-panel, but they don't use a federal form. They use a non-federal form, or what's often called a forensic form. Now, if you take collector training for DOT and you have a good trainer, they're going to incorporate non-DOT into it, because with DOT, you get the foundation of how you do it. The biggest difference is the form is slightly different, very slightly. And the other biggest difference is you're not required to do a split collection for non-DOT. You are required to do it for DOT. Now, we could do a whole hour on the difference between DOT and
Right.
non-DOT, but that's the quick answer.
Okay. So what
Hopefully, that's what you told them when they asked you.
I did. And I went in to even
Okay.
give them examples because when I first started out as a collection site, I was doing the DOT drug testing as well as non-DOT. So that was your child welfare division for DSS. And it included the
Yep.
oral and the hair and different things like that. But they actually wanted the split specimen. So that was the DOT like, and they actually adopted the regulations of the DOT. So that was those that did train with me, they did get to see that difference.
Yeah, and many organizations want it to be DOT-like,
Hmm.
but it's not. Doesn't mean you use the same form. You could do a split if that's what the customer wants. And just another quick example, because a lot of people get confused on this. Under the Federal Motor Carrier Safety Administration, which is your trucking industry, okay, not every type of truck is subject to DOT drug and alcohol testing regulations.
Mm.
The truck has to be over 26,001 pounds gross vehicle weight rating, or with a tow, a combined gross vehicle weight rating of 26,001 pounds. There could be like a plumbing company that has box trucks that are 10,000 pounds, and they have CDL's drivers driving those box trucks. They're only 10,000 pounds. They are not subject to DOT regulations
Mm.
because they don't meet that criteria of 26,001 pounds.
So that driver wouldn't have to be in the consortium for randoms or anything like that.
Not the DOT consortium. They could be in a non-DOT consortium,
Okay.
but they cannot be in the DOT consortium.
So Since we're talking about consortiums, what is that?
So under the DOT regulations and under best practices for non-DOT, a company under DOT has to do random testing. It's required. Okay. There's two different types of random testing pools. Think of it like a swimming pool. Okay. One is a standalone pool. You got company X, all their people are in the standalone pool. All their people are in the same swimming pool. And we do random selections based on, let's say there's 20 people, we do it based on those 20 people. And if we have to test 50% annually, that means we're testing 10 people over the course of the year. That's a standalone pool, one company. Okay. A consortium is where we take multiple companies, we put them all in one swimming pool. So it may have 5 drivers from one company, 10 drivers from another company, 3 drivers from another company, and I got 11 owner operators, one single person. Now, owner operators are required to be in a consortium because we can't test 50% of one person.
Right.
So collectively, let's say we got 100 people in our consortium, and it could be 24 companies involved. They're all in the consortium. They're all in compliance. At 50% over the course of the year, we're going to do 50 tests. Maybe Bob's Trucking has 3 people. They never got picked. That's okay. They're still in compliance because they were in the consortium all year long. Every selection period, which typically would be done quarterly, okay, everybody has an equal chance. It's like if we dealt out a few cards from a deck of cards and we got 3 aces, okay, we might put them back in and shuffle them again. We might not get the 3 aces the next time, or we might get 1 ace, or we might get all 3 again. Everybody has an equal chance every selection period, and it's possible that some people will never get selected.
And then you have those that when I go and do randoms, they get me every time. They're just picking on me, but it could be the computer, right?
Yeah, well, nobody's picking on them. They have an equal chance. They have an equal chance every time. But when people say that to me, we go back and look at the records, and yeah, they got picked last time also, but that was the only other time they got picked.
Right.
So they're not complaining about the year before when they never got picked,
All right.
or the year before that when they never got picked. All of a sudden, I get picked every time when it's only been 2 times in a row.
Wow. So I was marketing to a company. They're a medical transport company, and they do have DOT drivers. And they told me that they don't have to. They're not in a consortium. They said that they have to report annually to something. Is that a law, or is that something that I'm unaware of? Because they weren't informed at all. Like they weren't knowledgeable of the randoms program.
And they said they don't have to be in a random program.
They said they're DOT, they have to report to somebody. And I asked them
Okay.
about the clearinghouse, which is my next question for you to explain the FMCSA clearinghouse, but I don't know if they were
Okay.
just
So let's talk about the medical transport first, because
okay.
I can only focus on one thing at a
One
time.
thing.
Okay. So throughout the United States, there are companies that transport people to their doctor's appointments or their medical procedures, hospital visits, and often they're transporting Medicare patients. Okay. And Medicare, the US government, is paying that company to transport people. So that's how they get paid. Okay. And that type of transport, because the government is paying for it, falls under the Federal Transit Administration, FTA. So they're not FMCSA. They're not truck drivers. They're not bus drivers. They might fall under FTA. If they're regulated by FTA, that's still DOT, and it still requires DOT drug testing and alcohol testing, and still requires random testing. Okay, different pool, standalone or consortium, but if they're DOT and they're regulated by FTA, they are required to have a drug and alcohol testing program. falls under FTA. Now, traditionally, years past before this is all kind of relatively new, where transporting people to their doctor's appointments and the government paying for it.
Mhm.
Yeah, it might be 5 or 6, 7 years old, but traditionally, FTA is your county and city buses and your subway systems. It's federally subsidized mass transit systems. When
Okay.
you pay your $2 to get on the New York subway system, the government's paying another $2 because it costs more than what they charge.
Okay.
So that's kind of what, when somebody says they're in the medical transport business, if they're DOT, they got to do drug testing and they got to have a random pool. And they're probably regulated by FTA.
Okay. So that's where I come in as the expert under Mr. Joe Riley and kind of inform them of that because they may think that they don't have to do that because they've never heard of it, especially
Right.
here in
You would
South
ask them,
Carolina.
are you regulated by the Federal Transit Administration? Is that who pays you to transport people?
Okay.
And when they say we're DOT, then you would say, well, explain to me what you mean by that. Because if you're DOT, you're required to have random testing. And sometimes this is really important for everybody. Sometimes it's when somebody, you ask a question, they answer the question or whatever. Sometimes you have to ask more questions. You have to ask clarifying questions. You got to drill down and dig and get more specific. Okay,
Right.
because to me, when someone says to me, "Well, we're DOT, but we don't have to do a consortium," that's a red flag
Right.
because it doesn't match up. If you're DOT, you have to do random consortium
Right.
testing.
Right. So how would you explain the clearinghouse? Is that for
Okay,
FRA, FTA, or just FMCSA?
okay. The clearinghouse only applies to Federal Motor Carrier Safety Administration, FMCSA, which would be truck drivers of 26,001 pounds or more, bus drivers of 16 or more passengers, including the driver, public coach buses, not mass transit buses, okay, and people that transport hazardous materials that require the vehicle to be plate carded, to have signage on it. All of those employers are required to register in the clearinghouse. It's a database that keeps track of people that have had violations, drivers that have had drug and alcohol testing violations, not speeding, not running a red light, but a drug and alcohol testing violation. And once they have that violation, they're put on a prohibited list. So when the employer goes to hire somebody and they're on the prohibited list, they don't hire them until they get off the prohibited list. How do you get off the prohibited list? You have to go to a substance abuse professional, a SAP, and you have to go through a treatment or education program or both. And then you get cleared by the SAP to return to duty. You need a return to duty test that needs to be negative. It's done under direct observation. And then the SAP also will give the employer a schedule of required follow-up testing, and the employer has you do follow-up testing. They can hire you after the return to duty test, but you have to do follow-up testing to make sure you're clean. Those follow-up tests are direct observation also. And so employers register in the clearinghouse, drivers register in the clearinghouse, MROs report positive drug tests in the clearinghouse, employers report positive alcohol tests because alcohol tests don't go through the MRO. Employers report refusals to test, which is also a violation, and employers report actual knowledge where they witness drug or alcohol use on the job.
So the collector doesn't have to register and be able to have access to the clearinghouse?
If you're only a collector, you don't register, you don't have access, you don't do anything in the clearinghouse. But if you're a collector and then now you kind of move into being a TPA, then an employer might hire you to do all that stuff for them. And you can earn extra revenue with that.
Okay, awesome. Well, speaking of revenue, let's say a student came to Vigenics Technical Training Center and they've completed their mocks and everything like that. And they shadowed in Vigenics Laboratory Services, which is our collection site for major and minor labs. And they're saying, hey, I want to do this. I can do this. What is the first thing someone should know before getting started with their own business, and how is that funnel as far as like having a business plan? Like you said, when should they expect to, have a good flow of income, overhead? Because I've learned that one of my biggest mistakes was I jumped into this big lease. I had this big building and I really didn't need that much space to get the job done with drug testing. What is, I guess, that process of starting your own business without making the mistakes that I did?
Okay, so there's a lot to it. Okay, I'm going to put a link in the chat there um, where I have like a 20-page free report to answer that question.
I
But
think
I'll
that's probably
answer
the
it as
link I
briefly.
went to.
Yeah, I'll answer it as briefly as I can. Okay.
Okay.
And you're talking about somebody who's already been trained to do collections. So
Yep,
they
they've
got
been
that part
trained,
done.
shadowing
Okay.
me.
But but they got to know a little bit about starting a business. Are you going to be a sole proprietor? Are you going to be a partnership? Are you going to be an LLC? Are you going to be a corporation? You can learn all that online for free or on AI for free. Okay. What are the types of businesses? What are the pros and cons of each one? Okay. Then then they start their business entity. Okay. They got to register it with the state that they're in. It's registering as a business. Doesn't matter what kind of business. Okay. The state doesn't care. Okay. The local city, town, or county might care because they're gonna issue a business license, occupational license for the facility that you open, or if you're doing a home business. Okay. Then they should type up the story of what do they think their business is going to look like. What are they going to do? Are they going to do mobile collections? Are they going to open up an office? Are they going to have employees? Is it just going to be themselves? That's kind of the start of the business plan, okay? To get organized as to what are we going to do and what's our business name? What's our website domain address? Get started on writing a plan for a website. What's our branding going to look like? Colors, logo, be consistent. Don't, have a pink background and, three other colors writing, and,
Right.
don't look, you got to look professional.
Professional.
Okay. Um, so all that's outlined in the report that I provide. You can also, you can go to the small business development agency in your town through the Chamber of Commerce or through the local college or university, small business administration, small business development centers are very, very helpful. Those are free resources, okay? Do your homework, do your research. And now if you're ready to go, you need to have a lab.
Mhm.
And you call up the lab and you say, I want to set up an account. What do they say, Margaret?
I mean, they want to know, who are you? How long have you been doing it? Yeah.
Right. And when you say, I'm just starting, they're going to say, we're not going to set you up an account
Right.
because you need to have a credit history, blah, blah, blah. So how do you get around that? You call Joe Reilly. National Drug Screening sets
Right.
up underneath us. We set up a house account for somebody new coming into business. You can work under our house account. You have a lab, then you have an MRO, and you have getting your results reported to you. Okay. At some point down the road, you want to move from being a collector only to being a TPA. We have a program for that too that offers software, the ability to open up employer accounts, the ability to manage random standalone pools and random consortium pools. So the starting point is to read the report with the link that Margaret's going to share with you. It's on my website, joereilly.com. Just go to business startup and then make a plan, write up a plan. It doesn't have to be fancy or 100 pages. It could be one page. Just what do you plan on doing? You gotta have a starting point. Research how to get a business started from the legal point of view. Website, consider that, colors, branding, name, domain, website, initial marketing, Google business profile, We can help you with all those things. Um, but you got to start with, I'm going to do it. And here's my initial plan. Let me ask you a question or two, just before we close out.
Okay.
Um, are you doing mobile drug screen collections?
I am.
Okay. And are you doing them after hours?
See, the area that I'm in, I really don't get calls, so I'm in the system to do after hour collections, but
Okay.
we're not under a TPA that really needs it right now.
Okay. So there is, when we do consulting with folks, we provide a list of over 50 TPAs all around the country,
Okay.
and and we provide you a sample email to send them so you can get registered with lots and lots of TPAs. But depending on where you're located, they may or may not need mobile collections in your area. But for those that are getting started out, um, if you can find people that need mobile collections, and if they need them after hours for post-accident or reasonable suspension, that's where you can earn more money, especially getting started out, because you got to go out 11 o'clock at night to do a mobile collection. You could make three, four, $500 in that one collection.
Right. Yeah, I've done that because I'm right on the border of North Carolina and South Carolina. So I work
Right.
closely with North Carolina DOT and different things like that. So I've had to go to North Carolina in the middle of the night for a post accident
Yeah.
on the interstate.
And you get paid a lot more. Um,
Mhm.
and sometimes even in the town that you're in, if you go to some of the big box retailers that are open like till 8 o'clock at night or 9 o'clock at night, like a Home Depot or Lowe's, and um, just to let them know you're in town and that you can come out and help them if they need help, because they probably have a contract with a big TPA somewhere. But when they have an accident at 8:30 at night, that TPA ain't around to help them.
Right.
If they know that you can come out there, even if you did the collection on their own lab account or the TPA's lab account, you're getting paid at least to do the collection,
Mhm.
and you can charge a premium for that for going
Right.
out after hours.
Right.
So
Okay.
keep
Yeah.
that in mind, everybody. Yeah, so I just wanted to bring that up.
Yes, sir. Well, thank you, and I look forward to sending some people your way.
I appreciate that very much. You have a great rest of your day.
You too. Bye bye.